think that very respectfully now, I wouldn't want to make fun of you guys, but we could use some more anatomy review as well. So we're going to go around the room, do that a little bit just to make sure we're all on the same page. I'd like to call on somebody I didn't call on yesterday. Mr. Singletary, I didn't have an opportunity to quiz you on anything yesterday. I just want to ask you a couple of things, if that's okay, since you didn't get to participate. You there, sir?
I'm sorry, but your statement just said I'm not going to call anybody that I called on yesterday, and you called me 1, 2, 3 or 4 times yesterday.
Did I? I don't remember that at all, sir. Let's see. Can you see this picture here?
Not yet.
What? Are you in front of a computer?
I just see your face. It's going around. It's just going. It's my computer. It's just going around in circles.
Well,
but I'm going to suspect that you're probably pointing at the spine. I'm going to go out on a limb.
That's pretty good. While you're waiting for your picture to come up, then I'll ask you some questions, and you let me know when the picture comes up. I'll stop asking other questions once the picture comes up, okay?
Mine will probably consist of L1 through L5.
Probably.
C1 through 7.
But in the meantime, since you can't see the picture, let me ask you, what are the 3 calf muscles, Mr. Singletary?
Oh, I have no idea. I'm just kidding. Gastrocnemius, soleus, and plantaris.
Good. What are the names of the muscles found on the posterior femoral compartment?
Okay, so the posterior femoral compartment, so that's in the back. And you said the 3?
Yeah, I didn't say 3, you just did, which means you know what you're talking about. Very good job, sir. What are they?
Okay, so that would be gastrocnemius, soleus, and then the tibialis posterior.
Woo!
Am I in the...
Okay, so you are still on the human body, and that's good. But I would like to talk about the posterior, and I heard you say back, which is good. Posterior means back. Femoral compartment.
Oh.
You were giving me stuff in the sural region.
Oh, sorry.
That's okay. I'm doing this. I'm asked, by the way, Mr. Singletary. I'm just having fun with you. But for everybody's edification, I am asking questions in a different manner to make sure you know where stuff's located now. We're trying to put various vocabulary together. So that's why I didn't just say, tell me the 3 hamstrings. I said, tell me the muscles that are found in the posterior femoral compartment, the back of your thigh. What are those muscles?
My bad, because that's the hamstring muscles, correct?
Yes.
Yep. Biceps femoris, semitendinosus, and semimembranosus. I didn't catch the femoral word when you said
that's
that.
Okay.
My bad.
That's okay.
My bad. My
Stop.
bad.
It's okay. Stop. Which one of those hamstrings is most lateral? No.
You said the lateral side though.
I sure did.
Because I'm looking at the biceps femoris and that more. Okay, maybe I'm wrong.
You are wrong. Which one of those hamstrings is most lateral? Since when you started saying semi, I said no, so that rules out what?
Well, I know. I'm actually looking at the picture of it.
Just answer the question, sir. Which one of those is most lateral?
Biceps femoris.
Yes. The way I remember the semimembranosus and semitendinosus are most medial is semimembranosus starts with an M and so does medial.
Okay, but I'm looking at the picture.
The picture's wrong. Tapscott's right. Picture's wrong. Stick with me. What are the 3 gluteals?
Okay. Gluteus maximus, gluteus minimus, and gluteus minimus.
Okay. Which one is most posterior?
That's gluteus maximus.
Good. Which one is most anterior?
Gluteus minimus.
Good. What are the deep 6 lateral hip rotators?
Okay, that's piriformis, quadratus femoris.
Yes,
pardon the pronunciation.
Obturator.
Obturator internus. Obturator externus. Okay.
Yeah, you're doing it. You're doing it, buddy.
Gemella.
Gemellus.
superior, gemellus inferior.
Beautiful. Awesome. Which one of those is known for pinching on the sciatic nerve?
That's piriformis.
That's right. Which two of those muscles are most palpatable? And by the way, one of these two muscles is the most superior, and the other one is the most inferior. But they're also the most palpatable.
I believe it's the quadratus femoris.
Quadratus femoris is the most inferior and one of the most palpatable. What's the most superior?
Oh, piriformis. I'm sorry.
Thank you.
Piriformis is
Piriformis, and the other four live between them. Awesome job, sir. Thank you. What are the three spinal erectors?
Longissimus.
Longissimus.
Longissimus, spinalis, and Ooh, I hate Latin.
Iliocostalis.
Costalis.
Yes, beautiful. Sir, can you tell me them from medial to lateral?
Medial is more the center, so we
yes.
going to go spinalis, spinalis, longissimus, and then iliocostalis.
Sir, actually, I really love what you did. I like that you were talking out loud because he explained how he broke down the thing. I said, from medial lateral, he goes, medial is the most middle. Yes, good. And then you kind of thought through it. Good. Nicely done. Hey, what are the shoelace muscles called that are underneath the spinal erectors?
It's the multifidus.
Yep, multifidus and...
rotaries.
Rotatories. Good.
Rotatories.
Good. Can you see the picture on the screen yet, sir?
Yes, I can now.
Oh, okay. Good. Let's go back to that. All right, sir. What bone is this?
That's a sacrum.
What bone is right above it?
That's the lumbar. Oh, I'm sorry about yesterday. I was mixing up my words because I kept saying thoracic lumbar, and I'm like,
sir, you're
no
fine.
Wonder.
Sir, I want to keep you on track though, because we want to go.
Sorry.
What bone is this?
Sorry. That's the lumbar vertebra, and that's the L1 through L5.
What bone is this, sir?
Oh, the actual bone.
What is the name of this bone?
The joint. You look at the L5. Sorry.
Thank you. L5. If this is L1, what's above it?
T12.
Yes. If this is T1, what's above it?
C7.
Yep. What's the topmost vertebrae called?
C1 or the atlas.
Yes. What is the one underneath that one called?
The axius.
Yes.
Axis.
Axis or C2. Nicely done. Okay. What bone is this?
That's your femur.
Yes. What's this thick medial bone called?
The tibia.
Yes. What's this thin lateral bone called?
That's your fibia.
Yep. What's this little round sesamoid bone called?
Your patella.
Yeah. No, nicely done. You're doing great. Patella. You're doing great.
Patella.
What's this bone up here called? Your arm bone.
Your humerus, the shaft.
Yes.
Well, even this.
You're doing great. What is this bone going to the thumb called?
That is your... God, it's so
You're
small.
doing really good. Mr. Singletary.
Radius?
Yes, radius. What's this bone going to
That's
your...
the ulna.
Yeah. Sir, you have
It's
definitely...
so small. Sorry, it's so small in my computer.
No. You've really redeemed yourself. You've done awesome. Take a break, sir. Catch your breath. That was really good. Thank you. Okay. Miss Abelos.
Yes, sir.
Miss Abelos, what is this shoulder joint called here, this ball and socket shoulder joint called here?
The glenohumeral joint.
Yes, because the humerus comes to the glenoid fossa. What is this hip joint called?
The The acetabular femoral joint.
I love that. Yes, because it's where the femur meets the acetabulum, which is also kind of a fossa in there, right? What is the knee joint called?
It is the tibiofemoral joint.
Yes, nicely done. What is the elbow joint called?
Oh my goodness, the humero-ulnar joint.
Yes, very good, because it's really mainly the I'm not saying the humerus doesn't interact with the radius, guys, but that's a better answer, yes. What is the wrist joint called?
the radiocarpal joint.
Awesome. Thank you, Miss Abelos. Mr. Craven, you raised your hand, sir.
Yeah, so like I understand like why they name the joints like after like the bones that are connected there, right? But like how do they come up with the order? Because some of them seem like they're like from superior to inferior, and then some are like inferior to superior.
Yeah, I don't know the answer to that question, and I wonder if it's a little bit like language. So what I mean by that is you know how there's just some stuff that, like, there's some stuff that we say here in the United States. Well, let's take Mr. Richards, and I'm really not trying to pick on you, Mr. Richards, for example. We both speak English, right? Mr. Richards and we all speak English, and we understand him and he understands us, but we do phrase things differently. I'm not talking about using different words. I'm actually talking about using the same words differently a little bit. And so I think it's kind of like, why do we say 28th Street and Bell instead of Bell and 28th Street? There's just certain things that sound different to us that we kind of roll off in a certain way. And so I think people just got used to saying tibial-femoral. I don't think there's a structure to it. If you said the femoral tibial joint, I think people would understand what you meant. So that's my best answer, is it's just kind of the way. And by the way, I wouldn't deduct points. If you flip the two bones, I'm fine with that. If the hip joint is also called the femoral acetabular joint, to me that's the same as the acetabular femoral joint. Yeah. So that's my best answer is we get used to saying it a certain way and people use that language over and over again.
For sure, I like the street analogy. That's pretty good.
Yeah, and I don't know if that's the way you say it, but I think there's other stuff like that, and I was trying to come up with a really good example, especially when I brought up Mr. Richards, but I couldn't think. I just know that, like, well, here's what I always think. This isn't Mr. Richards, but in Canada, people always say, I go to college, right? I went to university. Right? They always say, I went to university. We always say we went to the university. Now, we're both saying the exact same thing, but it's just a different way that they phrase that thing every time. Every time I hear it. Yep, I went to university. I've never heard anybody in the United States say I went to university. I went to a university. I went to the university. But we always put the article in front of it, and they don't. I don't know. It's weird. Okay, Mr. Craven, by the way, since your mic is working great, your brain is working great, let's take a look at a few things here, huh? How do you feel about that?
Yeah, I can do without it.
You could. Very honest, Mr. Craven. Mr. Craven, what's this bone down here?
Sacrum.
Okay, smarty pants. What's this bone below the sacrum?
The coccyx?
It is your coccyx. Yep, it's your tailbone. Coccyx. What's this bone all the way at the top of the spine?
The atlas C1.
Yes, what's the one right below it?
C2 axis.
Yes, sir. Sir, what's this jawbone called?
Mandible.
Yes, I love that. Sir, what's the largest bone in the body here called?
Femur.
Yes. Sir, this gets trickier. The hip bones are made out of 3 bones. What's this top big bone called?
The ilium.
Yes, you're doing great. Sir, you might be sitting on it right now. What's this bone in the back called?
The pubis.
Is your pubic region in the back of your body?
Sometimes.
Wow. Okay,
I'm very talented.
This is a family show, so we can't get into that right now, sir. But
so there's the
pubic region's up front here.
Okay.
And then you got these bones you sit on. Some people even call them the sits bones. By the way, all your hamstrings attached to these, and really a lot of your adductors do. So you got the ilium up here, the pubis in front, and this thing down here.
It's not the ischium, is it?
It is the ischium.
Oh.
The ischium is in your tuschium.
So I always thought it was like once like the ilium curves off, that was the ischium. Like, you know what I mean? Like So like the ischium was like the top of the bone, and then as you like go lower.
No, the ilium's the top up here. Believe it or not, the ischium below and the pubis above make this circle that's called the obturator foramen.
So like the ilium's kind of like the shoulder blade of the legs.
Oh my God, I don't even understand that. I don't know, sir.
like it's the same shape, and it kind of does the same thing as the scapula.
Well, it doesn't move around.
But it's like if you I'm picturing like the human body as like a dog, and like if we were on all fours.
Yes, and actually, when you study dogs, they almost do have kind of scapulas back in their hips. They're not quite hips like normal. Yes. Okay. All right. You've now confused me enough that I'm going to move on, sir.
Yes.
Thank you. Good job. Very good job. Mr. Singletary, you raised your hand, sir.
Yeah, I thought that was the ischial tuberosity.
Well, the bumps on the ischium are called the ischial tuberosity. Tuberosity means bumps. But you can't have an ischial tuberosity unless you're on the ischium. So this back of this ischium here, which you can't see in this picture, the back of this ischium here has all sorts of bumps on it that your hamstring's hooked to. Yeah.
Okay,
cool.
gotcha.
All right. Thank you, thank you. Miss Carrillo. Miss Carrillo, what bone is
Yes,
this?
Master Chef.
Miss Carrillo, what bone is this?
The calcaneus?
Yes, it is the calcaneus, right. What three muscles insert into the calcaneus via the calcaneal tendon?
Gastrocnemius, soleus, and plantaris.
Yes, and what is the main action of those three muscles because of that?
Oh gosh, I got nervous.
It's hard. What I'm doing is really hard because I'm skipping around.
I'm trying to think because I always get the feet confused. It's flexion. Calf raises are flexion. Is it flexion?
Well, the problem is there's no flexion extension. There's two flexions in the feet. It's either plantar flexion or dorsiflexion.
Plantar flexion.
Right, because you're planting your foot so hard it raises you up. Right, dorsiflexion, you're stopping a door. Nicely done, though, ma'am. Hey, Miss Carrillo, what's the longest muscle in the body?
Sartorius.
Okay, that's an inside joke, everybody. Because she made a silly mistake, and so we have to chastise her for months about it. Okay, awesome. Hey, Miss Carrillo, what is this union, this joint, really, between the two hips here in front called?
The pubis symphysis.
Yep, pubic symphysis or pubis symphysis would be absolutely fine. Cool. That's what holds the front of the hips together. The back of the hips are hooked to the sacrum. What's this joint back here called?
The sacroiliac joint. I don't know what the proper word.
That's it. Sacroiliac
Oh,
joint. That's perfect. SI joint, but I prefer you say sacroiliac while we're learning. But yes. Awesome, awesome, awesome. Hey, what do you call the joint between the sacrum and L5?
It was L5S1 joint.
Yes. Thank you, thank you. Excellent memory. What do we call the joint between L5 and L4?
The joint between L5 and L4. This.
Don't overthink it, please.
Is it L4, L5?
Yes, yes, literally. Or L5, L4. I think most people say L4, L5.
Okay.
They're just trying to describe where the two bones come together so they know which disc they're talking about. And again, I said this yesterday, I'm just saying it again because it's helpful. Most people, when they have slipped discs or herniated discs, it's L5S1, that little disc, or L4, L5. It's just very common for it to be down in this area because they've got all the weight of all the other stuff up above it. Cool. Thank you, Miss Carrillo. Well done. Hey, Miss Clayton.
Yes?
Miss Clayton, how many ribs do you have?
12?
Yes. What are the first 7 ribs called?
True ribs?
Yes. Why are they called true ribs?
Because they tell the truth.
Yes, that is exactly wrong, but it was a great lie.
Because they're connected to, they wrap all the way around.
They are connected directly to the sternum via their own cartilage. Yeah.
Yeah.
Yes. What are ribs 8, 9, and 10 called?
False ribs.
Yes, and they are called false ribs, everybody, because look what they do. They connect to the cartilage of the 7th rib and take advantage of it to get to your sternum. That's why they're called false ribs. And what are ribs 11 and 12 called, madam?
Floating ribs, because they're just hanging out by themselves.
Yeah, they're hanging out in back. Yep, that's it. quick question, madam. The hips are made out of 3 bones. What is this topmost bone called?
Ilium.
Yep, and what's the one that you're sitting on behind here called?
Ischium.
Yep, and what's the one here in front called?
Pubic.
Thank you. Pubis or pubic is fine. We'll take it. Thank you, ma'am. Thank you, thank you.
Mhm.
Miss Dang!
Yes.
Hi, Miss Dang. I know this makes you nervous. Miss Dang, what is this bone?
This the. Just 1 second.
Make sure I'm on it.
The humerus.
No. The humerus is up here.
The
This
femur.
femur. Yes. Femur. Very good. Very good, Miss Dang. What is this bone here?
Fibula.
Oh, no. Close, though. Hold on. I'm on the wrong page now. The fibula is out here on the outside. What's the thick one on the inside?
Tibia.
Yes. Yes. Very good. Hold on. We're almost done. What is this bone here that goes to the thumb?
Goes to the thumb. Let me think. I just know before.
It's okay. This is very hard, Miss Dang. It's okay.
This the
Right.
ulna.
Nope. Ulna is the one that goes to the pinky.
Okay. The ulna.
So, what's next to the ulna? Radius.
Radius. Yes, radius.
Okay.
Sorry.
No, don't be sorry. Now let's review. What's this bone up here?
Humerus.
Perfect. Humerus. Say it again.
Humerus.
Beautiful.
Yes.
What's this bone down here that goes to the pinky?
You just said to me.
It's okay, my dear. We're learning. Ulna. Good. And what's this bone up here that goes to the thumb? Radius. Beautiful.
Radius.
And what's this big bone here? Femur. Really good. Two more. What's this kind of big bone down here?
Tibia.
Tibia. And what's this little bone out here?
Tibia. We just said it before. Tibia and
Fibula.
the fibula. Yeah.
Very good. Awesome. Thank you, Miss Deng. Take a break. It's very, very nerve-wracking.
Thank you,
I do understand. Mr. Jones, talk to me.
I thought of something just barely, but
Yeah.
the fibula is smaller than the tibula, and a fib is like a little line.
Oh, I like that. And it's the tibia, but yes, the fibula is a little fib. I like that. We're going to use that.
Yeah.
Tell me about the little lie that lies on the outside of the body, the lateral side, the little fib. Good.
And that too, yeah.
Yeah. Yeah, I got to watch out about those little lies, huh? Yeah. Hey, sir, Mr. Jones, thank you for sharing. Can I ask you some bone questions really quick?
Yep, let's see.
How many ribs do you have?
Oh, total?
Sure.
12.
Good. Total would actually be 24 because you got 12 on each side, but that's all right.
Oh, yeah, you're right.
12. So that's where I thought you were going when you said total. What are the first 7 ribs called?
They are your true ribs.
Yes, why are they true ribs?
Because they're connected. They don't float.
Yes, but you've got other ribs that are connected and don't float that aren't called true ribs.
Oh, they connect to the sternum.
They connect directly to the sternum via their own cartilage.
Gotcha.
What are ribs 8, 9, and 10 called?
They are
If they're not
floating ribs.
If they're not true, they must be.
Oh, they're the false.
Yes. Do they connect to the sternum?
Kind of.
They do, sir. What makes them false is they connect to the sternum via the cartilage of the 7th rib. They piggyback.
Yeah, so it's like...
So they're not true, they're kind of faking it. So the first 7 ribs go directly to the sternum on their own cartilage. 8, 9, and 10 are false ribs. They actually connect into the cartilage of the 7th rib before they go to the sternum. And what are ribs 11 and 12 called?
Those are the floating ribs.
Cool. And they don't connect to the sternum at all. They're floating. What is the top of your hips called?
Your ischium?
I hope
Or
not.
no, ilium.
Ilium. What is the thing that you're sitting on in back here
That's
called?
ischium.
Yes. And what is this? These 2 bones that come together right here in front called?
It's...
Just the bones.
Um,
By the way, I'm talking about the bones in the pubic region, if that helps.
pubis.
Oh, wow! Just like the region. Very cool, sir.
Yes.
What is this giant, the largest bone in your body called here?
Femur.
All right. What is this huge bump on the lateral side of the femur called?
The greater trochanter.
Thank you, sir. Thank you. You are good to go. Thank you.
Yay.
Greater trochanter is an important one. Yes. Miss Dimitruk. Oh, Mr. Jones. Yes, sir. Did you? Was that an accident? I think it was.
Yeah, accident.
Accident. Miss Dimitruk.
I got called on yesterday.
Yeah? Well, so did Mr. Singletary 6 times. Miss Dimitruk, really quickly, what's this big bone here called?
The femur.
What is this large bump on the outside of the femur called?
Greater trochanter.
Yeah. What do you suppose this small bump on the inside of the femur is called?
I'm going to go with a lesser trochanter.
Thank you, ma'am. Thank you. Do you happen to know what 2 very important muscles that these are hard questions, by the way, everybody. I recognize, Miss Dimitruk, this is stepping it up. But do you happen to know what 2 muscles that we often refer to by one name insert in the lesser trochanter of the femur? And they help
2 muscles by one name.
2 muscles that we often call by one name that insert into the lesser trochanter of the femur and help you do a flexion of your hip, a flexion of your acetabular femoral joint. In fact, they are the main hip flexors, and if they become shortened on people, they can cause all sorts of other problems because of anterior tilts and such. But anyway, I digress.
Good Lord. I'm going to go
What?
with...
I can give you some more hints, too.
I'm going to go with a quadricep. No?
No. One, by the way, has an origin on the what they call the
psoas major.
Yes, psoas major hooks to your low back right here.
And the iliac.
Iliacus. Psoas major and the iliacus both insert down here, and we call them what together? You've done the hard.
Iliosoas.
Yes, iliosoas. Yeah. The iliacus, by the way, is actually called the iliacus because it attaches to this big area inside your hip of your ilium. Psoas major actually hooks to your lumbar vertebrae from the inside, behind your tummy, and they both go down here and hook into your lesser trochanter. I think that was enough abuse for one day. Thank you, ma'am.
Thank you.
Mr. Bose. By the way,
Yes.
just everybody, you guys should know I'm asking questions that I obviously think are significant, right?
What?
Nothing.
What did you
I
say?
just want to point out to people that I'm obviously not just asking, like I'm not just trying to annoy Ms. Dimitruk. I'm asking questions that I think are important.
Of course.
Of course, right. As the person who makes tests in the massage department, I'm asking what I think are important questions. Mr. Bose, what is this big bone here called?
That would be your femur.
Cool. What's this big bump on the lateral side of the femur called?
That would be the greater trochanter.
Thank you. What's the little bump on the inside here called?
The lesser trochanter.
What 2 muscles insert into the lesser trochanter?
Is it the iliosoas?
Yes, the iliosoas. And the iliosoas stands for what 2 muscles? You just said both together.
The
Iliacus
iliacus. Yeah, iliacus.
and
the psoas
major.
major.
Not everybody has a psoas minor. That's why we don't
I
mention
was like,
it.
wait.
Yeah. It's weird, but that's why we say that. And by the way, once you guys graduate, you'll never hear anybody say anything but iliopsoas. They won't even remember it's two muscles, but they both attach in here. And one of the reasons we stretch those muscles is because it's really hard to get to them in here. You're never going to work this deep in somebody's inner thigh, and reaching behind their stomach is tricky. It can be done, by the way, but it's tricky. All right, Mr. Bose, let's go back to the greater trochanter. Yeah?
Okay.
Can you tell me, how about just 6 muscles that insert into the greater trochanter?
Into the greater trochanter. 6 of them?
6. They grab onto the lateral side of the greater trochanter so they can actually help to rotate the hip laterally.
Okay. So, is one of them the piriformis?
Yes, that would help to
Okay,
rotate
okay.
the hip laterally.
So, one of them's a piriformis. Are any of the gluteal muscles involved?
Well, yes, you could kind of argue some of that too, but
are
yes,
you talking
the
you
gluteal.
talking about the deep 6?
Yeah.
Or
Yes, I'm trying to make a point. By the way, you're absolutely right. By the way, your gluteals come down and insert in there too. At least your anterior and your medial gluteal do too. But yeah, the deep 6. The point I'm trying to make for everybody is the deep 6. All 6 of the deep 6 attach somewhere on the greater trochanter, right? And so does the anterior glutes and the medial glutes too, right? They insert into the greater trochanter. So anyway, what are the deep 6, Mr. Bose?
Okay, so one of them is a piriformis. Is it gemellus or
Gemellus. It's gemellus. Okay. I don't know why.
Gemellus inferior, gemellus superior, obturator internus, obturator externus, and it has femoris in it.
4-sided muscle.
Quadratus femoris.
Beautiful. Yeah. And all of those essentially attach to the greater trochanter. Now, I mean, the quadratus femoris attaches to what's called the intertrochanteric crest, which is this crest between the two trochanters. But they all attach to the greater trochanter. It's just a really neat thing. And just to kind of make a point, Mr. Bose, I'm just about done, by the way. I don't mean to torture you. But what do you suppose? You just told me the insertion of the obturators, and by the way, the piriformis and the gemellus superior and inferior. But what do you suppose is the origin of the obturators? Where do they come from?
I'm thinking the pelvis.
Yes. What is this hole here called?
Hold on.
There's a hole that's made by your pubic and your ischium bones coming together, and we call that hole. Anybody?
Is the pubic tubercles?
No, the pubic tubercles are actually. By the way, I shouldn't have laughed. Pubic tubercles are right here, and they are an insertion point actually for. Oh gosh, I think your gracilis. Now you're challenging me. But anyway, what are your adductor muscles? What do we call a hole in the body? Remember? This is hard. Foramen. Foramen.
Foramen?
Yeah. Holes in the body are generally called foramen. This is called your obturator foramen, and the obturator internus, it hooks in on the inside of your hip, and the obturator externus hooks on the outside of this hole. They literally hook on that hole. Okay. Anyway, I'm sorry. I was just trying to make a point about how you can match up names and things like that. Take a break. You're doing good. Thank you, ma'am.
Cool.
Thank you, thank you. Miss Everson. Miss Everson? You can run, but you can't hide. Miss Everson. Last call for Miss Everson. Before I mark you out of here. Going once? Going twice? No? All right. Okay. Mr. Godot. Mr. Godot? Mr. Godot? Going once, going twice. Can other people hear me? Thank you. Okay, just making sure. All right. Miss Green.
Hello.
Hi, Miss Green. Thank you for validating my existence. Miss Green. Miss Green, can you see this picture?
Yeah.
Hey, what muscle is this?
It's our abs.
It is our abs. No, actually, I really like that kind of thought process. You're in the abdominal region. This is our abs. Which ab is it? It's abby
Which
normal.
ab is it?
Yeah. You've got more than one ab. Don't you? I do.
Yeah.
This one runs up and down. Which, believe it or not, helps your erector spinae muscles keep you erect from the front. It kind of pulls you to the
Is
front.
it your rectus abdominis?
Oh my gosh, the muscle that runs up and down. That's so neat. I love how all this stuff fits together. You guys keep pointing this out to me. Thank you. What do you suppose this muscle is on the side? These kind of sexy-like muscles down here on the side.
Are they your external obliques?
Yes, because if they were your internal obliques, you'd be dead. Right, those are inside. Very good. So this is rectus abdominis and external obliques. Beautiful. Up here are some finger-like projections or saw-toothed-like projections. Anyway, that some people mistake is external obliques, but they're not. They're kind of sneaking out from behind the lats. What are these saw-tooth-like projections here called? What muscle is that?
Is it the transverse abdominis?
No, transverse abdominis is underneath all this stuff, and it wraps around you like a belt. These are kind of coming out.
So would it be the quadratus lumborum?
Well, quadratus lumborum is an ab muscle. This is not an ab muscle. Quadratus lumborum is back. These are these finger-like, sawtooth-like projections that come sneaking out from underneath the axillary region here, really. Up here, you'll sometimes see. Yeah. Anyway, that doesn't help.
Right.
And it's something that starts with kind of a saw-like sound.
Yeah, no.
Serratus anterior.
Okay.
Serratus anterior. Cool. So what muscle is this?
The serratus anterior.
Awesome. Thank you, ma'am. Thank you.
Thank you.
I'm going to build on that. Miss Hendrickson,
Yes.
what muscle is this that's sneaking out the finger-like projections here?
The serratus anterior.
Yes. The serratus anterior is sneaking out here because it inserts into ribs 8 or 9. The first 8 or 9 ribs, 1 through 8 or 1 through 9, depending on what kind of person you are. I don't mean whether you're a good person or not. I just meant some people it inserts on the first 8 ribs, some people it inserts on the first 9 ribs. And you can't see all the insertions, but that's what it does down here. It's because a lot of your ribs are up here underneath your pecs you can't see. What is the origin of the serratus anterior?
I believe that one originates at the lateral border of the scapula.
Almost.
No, in the anterior medial border of the
Yes!
scapula.
It inserts in the medial border of the scapula. It reaches all the way underneath my ribs, goes back to my scapula. It is a super important muscle, right? What two actions does it perform since muscles can only pull and it's kind of coming forward and diagonal? What can it do to my scapula?
Protract? Or
Yes, no, protract. It can,
protract.
which is also called a what? What happens when my scapula moves away from my spine? Protract is correct, but that's also called
an abduction?
an abduction of the scapulothoracic joint. So it can protract or abduct. And what's the other movement it can do since they are running diagonal down a little bit?
rotating the scapula? No, that's not right. Down over the ribs.
This is really depressing me that you don't know the answer to this.
Sorry. I feel bad.
Oh, gosh, I don't know what I'm gonna do now. I'm so depressed.
Oh.
God, I'm even more depressed that you're not getting my hints that I keep saying too. That's really depressing me.
Sorry, tell me again. What were the
I can't even talk anymore. I'm so depressed. I can't.
So if it goes diagonally.
Yeah, kind of pulling it down. I'm kind of down right now too. I mean, I don't call it down. I call it something else.
Are you talking about a motion of the scapula?
Yeah. Well, it's attached to the scapula. It's not going to...
I see. So it depresses the scapula.
Yes! Why didn't I give you a clue? I'm so sorry. I should have said something like I'm depressed. Yes, it depresses the scapula and it protracts it or abducts it. That's cool. Let's keep going, and we're going to take a break, everybody, in just a second. Let me ask you this. Wow, I want to make sure I'm saying this right. It depends how we want to argue this, but there are two muscles for sure that literally kiss up against this muscle. They insert into the same place, but they do the opposite actions. Mm-hmm. So they can argue with this muscle. What are those two muscles?
The rhomboid and rhomboid major and subscapularis? No, not subscapularis.
Rhomboid major. What likes to hang out with the rhomboid major and is indiscernible from the rhomboid major, really?
Rhomboid minor?
Yes.
No.
Yes.
Okay.
You can't even tell the difference when you're rubbing somebody's back. Rhomboid major and minor literally connect with the scapula. The rhomboid major and minor run up a little bit, so they retract and adduct as my serratus anterior protracts and depresses.
Oh, okay.
And they actually wrap around my ribs. Those three muscles wrap around my ribs, really. And if they get tight, they can actually contract on my ribs, and it actually becomes hard to even take a big, deep breath. So when I get stressed, my ribs feel a little bit compacted, and then it's hard to take a breath, and then I start to have a panic attack, right? This can really lead to stress. And this is why really good therapists don't just rub the rhomboids and back. They get the serratus anterior in front, so they stop that argument. That's why I went through this long thing. I apologize. But good job. Thank you for thinking out loud with us. And I think that this is here very, very shortly.
You're muted.
Oh. My gosh, I just said all this really brilliant stuff, too. So, we're back. We are going to go to some new muscles here very shortly. I just have a few more questions to ask before we move on. I hope, I saw some people taking notes, by the way, which makes teachers cry. A happy tears inside when they see that, just to let you know. Because yes, these questions will come up again and again in very important places. By the way, I don't just think they're important for the year-end test, as I've hinted many times. I think they're important to your career as a massage therapist. To know that the serratus anterior has an origin on the first 8 or 9 ribs here at the sides of the body and inserts into the medial border of the scapula, where it actually connects fascially 100% with the rhomboids major and minor and does the exact opposite action and fights for control of the scapula. It can actually argue with itself and be a major factor in shoulder stress. Is like every massage therapist should know that, and very few do. So that's also the type of stuff as I'm getting ready to push you guys out of the nest, and you'll have to flap on your own. And you'll need to know this stuff, because you'll be really good therapists, and you'll make more money. You couldn't see my little flaps, but I was doing that. Okay. All right. Hey, Miss Everson.
Listen.
Miss Everson. Well, hello. I thought maybe I'd lost you. Miss Everson, I would love to ask you some questions. Let me share my screen with you really quickly here. Boom. Okay. Tell me if you can't see this in a second. Okay, Miss Everson, where am I? Can you see this picture?
Yes.
Can you see this little arrow dancing around on it?
Yes.
Good. Ms. Everson, what muscle is this?
Rectus abdominis.
That's correct. What action does it create? Since muscles can only pull.
It contracts due to a flexion of the body, so crunch.
Yeah, well said. A flexion of the vertebral column, if we want to get really technical, but you knew it, and I'm very happy with that. Okay, what are this muscle over here?
Transverse abdominis.
Well, they're running diagonal. Do you see how they're kind of coming down diagonal a little bit?
Okay.
Transverse is underneath here, and it goes straight across, and it's like a belt. This is diagonal. It's
So
diagonal.
is that from obliques then?
The what?
The obliques.
Which oblique? Don't you have two kinds?
Transverse, and then there's the.
All right. So, for what I can't hear you completely. I'm going to turn up my sound a little bit. Maybe you get closer to your mic. What are the 5 abdominals?
You've got your rectus abdominis, your transverse abdominis, your
So,
quadratus, and then external obliques, internal obliques.
there you go. Okay. So, we've determined that this is the rectus abdominis, correct?
Yes.
All right. What is this muscle here on the side that's running diagonal?
To me, they look like the external obliques.
They are the external obliques. Good. And by the way, oblique essentially means diagonal, everybody. You've got obliques in the back of your head, your suboccipitals, as well, and they run diagonal too. All right, so, and these are the external obliques because guess where the internal obliques are? They're underneath and you can't see them right now. Cool. All right. So what is this muscle above the external obliques here that kind of look like external obliques? They're little saw-like projections here, finger-like projections that come out from underneath the lats. Do you know what this muscle is?
I want to say serratus anterior, but
I want you to say serratus anterior. That's divine. The serratus anterior sneaks out here. You can't see much of it because it's covered by pecs and all sorts of stuff here. And it has an origin under this area here of the first 8 or 9 ribs. It's just different on different people. What is the insertion of the serratus anterior? Where does it go from the ribs?
Goes from the back all the way around to the ribs.
It does. It does. And actually, visually, you're on the right track, and that's kind of how I want you to think. What bone does it attach to, and where on that bone does it attach to?
Does it attach to the scapula, or does it attach to the ribs?
It does attach to the scapula, and it does attach to the ribs.
Okay,
So-
so it attaches the lateral end of the scapula and wraps around to the ribs.
Lateral end of the scapula. There's an inferior angle of the scapula.
Yes.
There's a lateral border.
Lateral border.
Okay. And the lateral border would be kind of on the side here, right?
I can only see the picture. Hang on.
Oh, got it. That's okay. How about the medial border of the scapula?
Does it go underneath the scapula?
Yes, it does. The scapula actually floats over the serratus anterior. I'm glad that you're very visual and that you can visualize that. It actually goes underneath the scapula and grabs onto the anterior portion of the medial border. It grabs on the medial border from the front.
Okay, that's cool.
So it is cool. My final question for you is, it attaches at the medial border in the same place 2 other muscles attach to the medial border, and these 2 muscles do the exact opposite of what the serratus anterior does, so they can argue the serratus anterior. What are those 2 muscles?
The rhomboids and
That's it. What are the names for the 2 rhomboids?
minor and major.
Very good. By the way, if you were going to say levator scapula, that would be arguably correct too, but very simply put, rhomboids major and minor. Thank you very much, Miss Everson. Mr. Godot, are you there, sir? Mr. Godot?
Yes.
Oh, Mr. Godot. All right. Nice to hear from you, sir. Mr. Godot, can you tell me can you see this picture here?
Yes.
Good. Can you tell me what muscle this is?
Which one? The abdomen?
Yeah.
Well, I'm What? Okay. I see it, but you asking for like a specific.
Name that muscle. Yeah. What is
The
this?
abdomen?
What is the abdomen is kind of like a location on your body. So which muscle is this? You're in the right area, but it's got a name.
Huh.
If you mean abdominals, you've got 5 abdominals. Which of the 5 abdominals is this?
Oh, okay. Okay. Sorry.
That's okay.
Erectus abdominis.
Rectus abdominis. Yes. Is this muscle here on the side?
The oblique. I know it, but I don't know the name. Hold on.
I think you're close.
Yeah, external oblique.
External obliques, yes. And sir, there are finger-like projections up here coming out from underneath the lats. They look like the external obliques, but they are not. What muscle is this?
Let me see. That one I have to look up. Oh, no, wait. Serratus anterior.
Serratus anterior, awesome. The serratus anterior has an origin on ribs, the first 8 or 9 ribs on every single person. You can't see them because they're underneath this person's pecs and everything like that. What is the insertion of the serratus anterior? What bone does it insert on?
You said the serratus anterior?
Yes, sir, I sure did.
Is it the scapula?
It is the scapula, sir. Where on the scapula does the serratus anterior insert?
The medial border?
Yes, sir, that is correct. What 2 muscles does it argue with that also insert on the medial border of the scapula?
What 2 muscles does it? The rhomboids.
Yeah, rhomboids. What are the names of the 2 rhomboids?
Minor and major?
Very good. Cool. All right. Do those questions sound familiar to you, sir?
Yeah, for sure.
All right.
We haven't done anatomy in a while. Well, we have, but it's like...
No,
yeah.
Mr. Godot, I asked if those sounded familiar to you because I just asked the last 2 or 3 people those exact same questions.
No, yeah, for sure.
That's what I was asking. Thank you. All right, everybody. Let's go on and talk about muscles of the foot. Yeah? Yeah? Okay. All right. Let me pull up this different slide thing. All right. We are going to talk about actually some really interesting stuff today. Your feet are super duper complex, right? Yes, they are. All right. And let me just share this new slide. Well, before I even say this, hold on, I gotta mute Mr. Godot. He's eating his microphone. Okay. So can anybody tell me the name of the muscle that flexes the digits, the long muscle that flexes the digits of your foot? Mr. Jones. You raised your hand, but you didn't unmute.
Flexor digitorum longus?
Yes! And where, by the way, so that muscle, the tendons come down underneath the foot and insert in the toes, and when they pull the toes down, and flexor digitorum longus was 100% correct. That's exactly what I want. Do you know where that muscle starts, just roughly? Like, where can I find the belly of that muscle?
Pretty sure I just did this last night. The patella? Does it go up the back of the leg too?
Back of the leg, yeah, back of the leg. So I just want to kind of point out it lives on the back of the tibia and the interosseous membrane there, but I don't even need all that kind of fancy talk. I just meant it's underneath the calves on the back of the leg, and it comes down there and grabs on the toes. We're good. Good. Thank you, sir. All right. Today, everybody, we're going to learn about some really unusual muscles that actually insert into the tendon of this muscle coming from the back of your leg, the flexor digitorum longus, and some muscles that have origins off this tendon and go into your toes too. And Ms. Dimitrik, I love you. She makes facial expressions when I talk, which make me like let me gauge what I'm saying. And her eyes just went kind of like that. I know I'm exaggerating, but still, I really appreciate it. Okay, so let me share this with you. Let me make sure they've got both muscles on here. Yes, they do. Okay. So, bear with me, everybody. This is actually super cool. Feet are very complex, and if you think about it, we always think about our hands as being super dexterous because we can pick up pens and we can pick our nose and we can button buttons and all that kind of stuff, right? But if your feet are off by a millimeter in articulation, you fall over, right? You can't balance. So you actually, the muscles in your feet and toes have to pull really actually much more precisely than your hands. Even if they're not picking stuff up, they have to be able to barely bend a toe, barely bend a little metatarsal, barely bend stuff to keep you stable. All right, so we're going to talk about two muscles. We're going to talk about four muscles, but the two that are really interesting is the Quadratus Plantae and the Lumbercles of the foot. So let's go back to the Quadratus Plantae. All right, do you see these tendons going up here to the toes? These tendons going to the toes go around the medial malleolus and up the back of the leg like Mr. Jones was telling us, because these are the tendons of the flexor digitorum longus. There is a four-sided muscle in the plantar region of your foot. Miss Carrillo, you love words. What should we call a four-sided, she's like, what? What should we call a four-sided muscle in the plantar region of your foot? What would just be a good name for that?
For sure, you would want something like, I don't know, quad in there. So maybe, just to spice it up, quadratus.
Love you. In the plantar region.
In the plantar region, so yeah.
Yeah. So
maybe plantae. Planta.
Yeah, plantae. Yeah. Quadratus plantae or plantae is a four-sided muscle in the plantar region of your foot. It's a four-sided muscle on the bottom of your foot. Remember, you guys know a four-sided muscle in your lumbar region, Quadratus lumborum. Later, we're going to learn about a four-sided muscle in your wrist. Yeah. Sorry, Mr. Singletary, please. Yes, sir.
Just curious, why didn't they just call it Quadratus plantar? Or that's just the way it is? They just call it Quadratus plantae?
Oh, I don't know. I wasn't there. You know what I mean? That's kind of a smart-ass answer, but it's also really the truth. Like I don't. This probably got named by some Grecian doctor who was drinking wine while he was dissecting a body, and he named this Quadratus plantae. You know what I mean? I don't know.
No, I get it.
By the way, there are also going to be some Latin rules that apply. I just don't know.
Okay, I was just curious.
But anyway, it is the four-sided muscle in the plantar region, Quadratus plantae. And what's fascinating about this muscle is it has an origin on your heel bone, your calcaneus, and it inserts into the tendons of the flexor digitorum longus, right? Oh, wow. Hands going up everywhere. Good. That's what I want to see. Okay, Mr. Jones, talk to me.
So I would guess that that's what gives you the ability to move your 3 middle toes at the same time, and then it's really hard to kind of coordinate the pinky toe, the 3 toes, and the big toe.
I mean, I don't agree with exactly what you said, but I agree with the reasoning behind what you said. So you're right. It's very hard to move individual toes unless they have individual muscles going to them. You do actually have some individual muscles going to your pinky toe and your big toe, but not your toes 2, 3, and 4.
So like I can easily raise my middle 3, but my pinky toe and big toe are going to go down.
Oh, to do that, you mean?
If that makes sense, yeah. So I'm thinking that muscle, I must have better mind-muscle connection with
Well,
that
when you're
one
moving your
than
toes
the
up,
others.
you're extending them, sir. This is all flexion muscles. These are on the bottom of your foot.
Oh, no, that's what I mean.
Okay.
For my 3 middles to flex,
Uh-huh.
my big toe and pinky toe extend.
Oh.
It's
Yes, I can explain why.
different for
No.
other
I can
people,
explain why. That's actually a really good point, too. So what's happening, sir, this is fascinating, actually. This is how real kinesiology works. Do you see how the flexor digitorum longus goes to toes 2, 3, 4, and 5, your pinky toe, too?
Yes.
Okay. So if you want to only flex 2, 3, and 4, what happens is you pull on your quadratus plantae, you use your flexor digitorum longus, and it tries to pull down all 4 toes, 2, 3, 4, and 5. And then your extensor digiti minimi brevis
takes over,
lifts up and holds the pinky up and stops that action from happening so the other 3 can go down.
Gotcha. All right.
It stops an undesirable action if you tell it to. If you don't, they're all 4 going to go down.
Yeah, okay.
Yeah. That's how complex body movements are done, is that you stop unwanted movements. Yeah. Very cool.
All right. Makes sense.
Yeah. Miss Carrillo, talk to me.
I just want to make sure I have this correct because I was writing it while you asked me the question. So the tendons right there, those are the tendons of the flexor digitorum longus, correct?
Yes. And remember, everybody, and I'm not suggesting you don't know this, Miss Carrillo. I just want to keep everybody kind of, the belly of the muscle that lives in the back of the leg, that's what contracts. You know, the stuff you guys eat, steak, that's contractile tissue. That's what pulls. The tendons are like these long ropes off those steaks, right? And so when the steak contracts, the rope gets pulled. You're looking at the ropes. You're looking at the tendon of that muscle, yes. And it's very long, and it just goes underneath feet. And the reason you just want tendon underneath your foot is if you had all those muscles underneath your foot would be this big round sausage thing and you wouldn't be able to walk on it, right? So a lot of the power for your feet comes from your legs. A lot of the power for my hands comes from my forearms, right? Anyway, continue, Miss Carrillo.
It was a little bit of a separate question. One of my people that I massage, it's usually around this area. It hurts when I massage there. Is that where you said that the fascia is like super tight?
Oh, it is.
Cause
Yes. If you are talking about this area right here, like right from the heel up,
yeah, there
is a tremendous amount of fascia there. Yes, that's where the plantar fasciitis is. All sorts of stuff, yes. Sorry, I said plantar fasciitis like they've already got fasciitis there. But the point is, all the major plantar fascia inserts in the back of the heel here, yes. And then there's major muscles like this one that are back here too, so yes. This has got to be one of the most important places on the foot, and that's why you run into the back of the heel here. You don't just go over it, you try to really work stuff off this heel, yeah. Well said. Mr. Richards, talk to me.
So it says that it's medial and lateral sides of the plantar, but the picture only shows medial. So how does it get to lateral? Because the calcaneus.
Oh.
So it said medial and lateral sides of plantar surface of the calcaneus. But the picture shows it just goes medial, sorry. How does it get to the lateral side?
I think we're misunderstanding. I'm really glad you asked this, because I think it's going to clear up something. But this is the calcaneus here, right?
Yes.
Okay. And I just want to make sure. Sorry, I don't think you could see my thing there. This is the calcaneus bone right here, right?
Yeah.
So forget this person has a body for a second. They're using medial and lateral to talk about this bone. And what they're really trying to fancily say is it runs across the entire bone here.
I see.
This would be the medial side. I know what you're thinking. You might be thinking medial down here or lateral over here, but they just really mean it goes all the way across this side, and they're trying to use fancy words to talk about that. It goes from the medial in back. It goes from the medial aspect to the lateral, or the medial aspect to the lateral aspect. So you're overthinking it. That's all. It attaches to the whole part of the heel there. It's this anterior part of the heel, believe it or not. But anyway, from left to right or right to left, both sides. That's all they're saying. Yeah. So Miss Carrillo, please.
And so because of that, the thinking on that logic, because it says posterior, in the insertion posterior lateral aspect of the flexor digitorum longus tendon, it's on the pinky toe, which is more lateral, so that's the lateral side, right?
Oh, where it says it's insertion?
Yeah, insertion.
Yeah, and I think what they're also just trying to they're trying to describe very tricky stuff to describe here.
Mm-hmm.
But they're saying it grabs it on this lateral side because this would be the medial side of that tendon.
Yeah.
Right?
Okay.
So you could also call it the inside. I prefer what they said, don't get me wrong, but they're just trying to describe this very weird attachment here. By the way, once you grab onto this thing here, you're really grabbing onto all these. They're not separate. They're all woven together, and you're going to be pulling on all of them. They're just kind of describing where it runs into this tendon. So, why does it do this? Who can tell me? There are probably several good answers to this question. Why? Why do you have this weird muscle, this four-sided muscle found in the plantar region called the Quadratus plantae? Ms. Hendrickson, please, take a stab.
Based on its location, I would think that it'd help you curl the foot.
It does. By the way, because it inserts into the ropes, the tendons of the flexor digitorum longus, it has to basically do what the flexor digitorum longus does. So it helps in a flexion of digits 2 through 5, just like the flexor digitorum longus does. Right? So it definitely does that. Excellent. Miss Carrillo, you want to add to that?
Also based on its location, it reminds me of the quadratus lumborum, and that is like a very powerful muscle to help you go back. So it's like it needs a powerful muscle for the foot to help with that flexion. So it needs it on the scale compared with the foot. It needs a powerful muscle for the foot.
So what I'm hearing you say that I would also agree, by the way, I agree with everything so far, is it helps to turbocharge the flexor digitorum longus by piggybacking another muscle on top of it, giving another powerhouse. You got a big one up the leg. Flexor digitorum longus is powerful, but you've got another one turbocharging it, hooking onto it, and helping it pull too, just like two people pulling on a rope. Yeah.
And also help it maybe stabilize a bit too, because it's very big and just holding on to it. It's just a really big muscle in its location. So.
Stabilize is definitely the right word. Anybody want to talk about stabilization here? Ms. Hendrickson?
Does it also provide stability for the arch of the foot?
Probably does. Absolutely. Anything that helps with flections of the foot's going to help with stability of the arch, which ties back to what Ms. Carrillo said too, that you need extra strength there in the foot, all that kind of stuff. I know Miss Avalos is doing like stuff. Yes, so absolutely. Mr. Richards, talk to me.
So because it's in the middle, does it stop you going from one side to the other?
Yeah, probably not. Probably not.
No? You know, because it's in the middle, when it tightens, you won't go to either side. You keep going straight kind of thing. That's what I was thinking.
If I understand what I don't know. You could be dead on accurate. The thing that this helps do is these tendons, what do they want to do? They want to pull off to the side of the foot. This Quadratus plantae helps kind of tugboat this back into place so that this flexor digitorum longus pulls the toes straight. Because the flexor digitorum longus is where you're getting your power from, right? But it can't help it. It's coming up the medial malleolus. It kind of pulls the toes out this way. This Quadratus plantae, like a tugboat, pulls that big ship so that it pulls straight down. And you get this nice curl of your toe. So it helps assist, it helps assist that movement. It would just be like, I don't know, if somebody's truck got stuck in a ditch and you hooked up a big winch to it, that's the flexor digitorum longus, but when it's coming up the ditch, maybe it's not coming up straight, so we have to kind of pull on the door a little bit and make sure it kind of goes the right direction, even though the power is still really coming from the flexor digitorum longus. It helps keep stuff on track, because we'd really like to pull these things straight back, but there's a heel in the way. So the power comes from up the leg, and this thing helps keep pulling it straight back. It's very interesting. It also shows you how much goes into, and this is what Ms. Correa was talking about, how much goes into arch support and power of a foot. So let's look at something else that's associated with the flexor digitorum longus tendon. Oh, let's not go past that. Let's look at the lumbricals of the foot. The lumbricals of the foot, and why can I not get on them? Come on. The lumbricals of the foot, here we go. The lumbricals of the foot are some of my favorite muscles. I just love them. They have an origin on this tendon. They actually live, they don't live on a bone. This is very unusual. Usually the origin of muscles is on a bone that doesn't move, right? That's what the origin is. Their origin is the tendon of the flexor digitorum longus. They grow out of the flexor digitorum longus. Yeah. Yes, Miss Hendrickson.
Is that unique? Is that the only place in the body that that happens?
Well, we're going to look at lumbricals in the hands, too.
Oh, okay.
And they have some similarities. But this is a very unusual thing, to answer your question, yes. By the way, I just to be honest, I didn't answer it fully because I'm not sure. I can't think of other instances, though. Let me put it that way. It is very unusual. That's why I said that. But I couldn't be like, never. Has this ever happened? I don't know. So the lumbricals are fascinating little muscles that are down here and have origins on the tendons of the flexor digitorum longus, right? And remember, down here is the Quadratus Plantae. You can't see it in this picture, but there's a Quadratus Plantae down here, right? And these guys insert into the proximal phalanges of these toes, right? And since they do that, they can help to flex your toes. And they also insert into the tendons of the extensor digitorum longus tendon that's on top of your foot. Now, this should blow your mind at this point, because we're getting ready to learn fascial lines. And the fact is, you've got this extensor digitorum longus coming from the top, this flexor digitorum longus coming from the bottom, and the lumbricals connect the two. In fact, the lumbricals come up in such a unique way that they can pull down these toes, but actually help extend the other ones. They can actually kind of tighten your toes. In fact, your lumbricals do this in your hands too. We'll get to it in a minute. But your lumbricals help flex some phalanges and extend other phalanges. And if you think about what I'm trying to flex and extend my fingers, what am I really doing? I'm making them rigid. So you guys use lumbricals all the time. It's how you poke people. We massage therapists love lumbricals, and you use them in your feet for kind of similar things. But also what I'm really trying to point out is this flexor digitorum longus and the extensor digitorum longus via the lumbricals and all this fascia here come together, and they connect the front fascial line of my body to the back fascial line of my body. Because all fascial lines connect. Because everything's connected. Because we're all one. But it's true. They really do connect for that reason. Miss Carrillo.
So I'm trying to understand like what I'm seeing in the picture. So because it flexes and extends, so is the belly like under, and then the end tendons go like up to help with the extending?
Yes.
So it's like a down and then it curves up.
Yeah. Right? So what happened? This is so hard to describe it. Can you see my hand?
Yeah.
Okay. Well, I've got to get something here. So it's hard to kind of explain, but if you can imagine something coming up and attaching to my proximal phalanges from the bottom, it would pull those down. But it also keeps going and hooks on top, And when it pulls, as it's pulling this down, it kind of peels my finger back. So it can pull this part of my hand down, but pull my fingers back with the extensor digitorum longus. And if you pull my proximal phalanges down, but my distal phalanges up, what you get is a very strong hand or toes. So, and it's super hard to visualize. And one of the most important things to really remember here is not the action of this muscle, which is really funky, but that it's connecting your extensor digitorum longus from the front to your flexor digitorum longus from the back, and those are going to be fascial lines. And that's really, really important. Because the way we stabilize ourselves is I don't just pull myself forward, I have to pull myself back. I don't just pull myself to the right, I have to pull myself to the left. And all these fascial lines hook together to give you, you know, this magnificent standing straight up and down person that you see in front of you. So, and they have to connect down in the feet. And so this is really significant. And this just occurred to me, but it kind of makes me think the feet are kind of important. I haven't mentioned that before, but I thought you guys are ready for that. Feet are kind of important a little bit. Miss Hendrickson.
So it just kind of reminded me of ballet dancers. Like they would probably go straight on their toes. Would that mean like their power? I mean, they have to have like really strong.
Yes.
Lumbricles.
Yes. Yes. Thank you. That is an excellent example. So obviously they have really strong calf muscles because they have to plantar flex too. But they are going on their toes. And they would have to have extremely strong lumbricles. They also, by the way, just have extremely strong extensor digitorum longuses and flexor digitorum longuses and extensor and flexor hallucis longuses and brevises, right? Because they're keeping the big toe there. But yes, you're right. In order to go straight on anything, in order for me to poke you with my fingers or go straight on my toes, I need to be pulling on both sides super hard. Just like when you guys stick out your arm and try to hold it really straight, you're flexing your biceps and your triceps at the same time. That's how you keep it from, I understand there's stuff up in the shoulder, but I'm talking about here. You fight yourself on purpose. So, and we do that all the time. That's, by the way, we do it in our shoulders. When I write, by the way, I actually lock down my serratus anterior without knowing it and my rhomboids. They fight on purpose there to keep my scapula from moving so I can write. Because otherwise your hand would wiggle. So you have to lock down the base of your arm to do that. That's fine. The reason people have so many problems back there is they work on a computer 8 hours a day and they don't unlock at the end of the day. They just kind of hold that tension and they never unlock. We fight ourselves all the time for good reasons. We want to do that. That's how I stabilize. If I want to stand still, right now to stand in front of you, I'm actually slightly tensing up to the right, the left, the front, the back. I'm not just standing.
Keep your balance.
Right. I have to be fighting myself. That's how a circus tent works, right? You pull down all the ropes, which is fine as long as you can release the ropes when you lay down. And some people lay down, probably all of us, by the way, not just some people. We lay down and we're like, I still am sore. And you shouldn't be sore at all. You should be laying down. You should be mush. I don't care what type of shape you're in. Everything should be soft, but we're not that way, right? Because we're still tense. Yeah. Thank you. Excellent example. Ballerina. Miss Savarino.
So like I had a question about the Quadratus Plantae or whatever.
Yes.
Since it's a four-sided muscle, does that have to do with like your balance, or like what are the muscles that are like strictly for like our balance?
Okay, so I'll try to answer this really, really well. But it's a tricky question. So, let's look at the upper leg. And I mean, by the way, you're constantly, oh gosh, there's so many things that have to do with balance. Balance is so darn tricky. So, and I'm not talking about inner ear stuff where I'm measuring where I am. That's really key, right? It doesn't matter what muscles I have. But and I'm not even talking about stuff that happens in my hips. We're just talking about the feet, kind of, right? So, stuff that matters in the feet is stuff that's going to articulate my feet into plantar flexions, dorsiflexions, inversions, and eversions. Okay? And so, of course, the flexor digitorum longus and extensor digitorum longus and the quadratus plantae, you know, all that kind of stuff helps with this type of stuff where I'm trying to control front and back. Okay? The stuff that helps me from left to right tends to be more things like your fibularis, longus and brevis, and your tibialis anterior, which both, remember, went around both sides of the foot, and they do opposite things. Tibialis anterior inverts you, fibularis longus and brevis, or peroneus longus and brevis everts you. And that's why you feel so tight in your shins after you've gone hiking, because the whole time hiking you're doing this. And those muscles are right next to each other. They go to different places, but they both kind of live anterior lateral part of your leg. And so those are the main ones. Don't get me wrong, you're using your pinky toes. In fact, the real way you walk is you walk from heel to big toe. You really, most people, their toes go out a little bit, their feet go out a little bit. You don't walk straight forward with your feet. They go out a little bit, and they should. And you walk from heel to big toe, and your outside toes are stabilizers. They actually create a little flexion if you start to roll out to the side a little bit. They create a little flexion.
So if you lose your big toe, you like can't walk?
It is hard, actually. I have an aunt that lost her big toe in a bicycle accident when she was a kid. She zipped it right off. And she can walk still, but it is actually difficult for her. Like, you know, she needs shoe support there, and she has this tiny little limp that you notice because she can't roll off that toe. And strangely enough, I just thought about it. I didn't even think about this till the second, till you brought up, thank you. She actually turns her feet in a little bit so she can use her other toes and roll off them instead of rolling off her big toe. I mean, I think that's why she's doing it. I never thought about that.
She's compensating.
She's compensating. Okay, yeah.
Yeah. Thanks, Mr. Tabscott.
Thank you. I love these questions. All right. So today we have learned about two muscles that are intimately associated with the flexor digitorum longus, right? We learned about one that has an origin on the calcaneus and inserts into the flexor digitorum longus, and that is the Quadratus plantae, the four-sided muscle that lives in the plantar region of the foot, which Miss Creo named for us today, which was wonderful. Thank you. Then we learned about a muscle that has an origin on the flexor digitorum longus, and it's called the lumbercles of the foot, and it's really sneaky little guy because it hooks onto the toes, but then wiggles up to the top of your foot and meets up with the extensor digitorum longus up there, and it connects the extensor digitorum longus to the flexor digitorum longus, so they can get along and they can work all your fascial lines and all sorts of wonderful stuff. It's amazing. We have two more muscles to learn about that are much simpler now. And that is the interossei muscles. Interossei, what do you suppose interossei means? Somebody, Miss Creo, what does interossei mean?
Inter is like in between.
Yes.
I don't know what let me look at the foot.
I've got.
Ossei is like, yeah, it's in between. It looks
in
like
between is inter. Miss Hendrickson, what's ossei refer to?
Bones.
Bone. Osteoporosis. So between the bones. So by the way, everybody, you have these in your hands too. You've got, they're slightly different, but it's the same concept exactly. So you've got dorsal interossei and plantar interossei. And don't worry about the like the exact actions of these muscles. You're not going to track one down really. But the plantar interossei help some flexion, right? Which is helpful. Don't get me wrong, but they help to adduct. They help to pull your toes together. They help to pull your toes together, and the dorsal interossei help to pull them apart a little bit. So again, these help with the integrity of your toes and your metatarsals. Remember, your foot always wants to smush out. And so these are stuff that are found between the bones. I know they go to your toes, but they're found between the bones of your metatarsals. That's where their belly is. And the ones that are most surface are the dorsal interossei, and the ones that are deeper are the plantar interossei, and they're both found between your toes. Yes, Miss Avalos?
So all of these muscles that we're learning today, besides the Quadratus plantae, of course, but they look like independent muscles. So you can train each one to move each toe at a time. Technically, you can.
Yes. Yes.
And the reason that the pinky toe is the weakest is because of like nerve compression, or from shoes, or.
Yeah, I'm not sure it is the weakest.
It's a hard time moving mine.
I know, like, like a lot of piano players say their weakest finger is their ring finger.
Oh.
And the pinky actually has some backup muscles, and I don't know that it is the weakest. So I'm going to lean more towards the shoe thing and the fact that we don't use it and stuff.
But you can actually move each toe independently because they have different origins and insertions.
Yes. I can't, but yes, it can be done. Yeah, no, you can be highly dexterous with your feet, and you can move them individually, yes. You could fire off, theoretically, I mean, you can't change where the tendons go, but you can fire off single fibers of any muscle in your body. So, yes, you could operate. Like the lumbricles do not have to work as the lumbricles. You're absolutely right. You could fire off 3 fibers of the lumbrical going to the second toe. Only. Okay. Yes, absolutely. And I actually suspect your brain does that. I suspect your brain does minor little adjustments. This is why our feet get so tired, besides the fact that we walk on them. But it's doing minor little adjustments. Otherwise, it would really look like I was doing this all the time. But my brain's really good now, and it just goes tweet, 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 tweet. Yes. So yes, ma'am. Answer a question, yes.
Thank you.
Thank you. Ms. Creo.
This will help with the visualization. Back to the lumbricles. Lumbricles in Latin means earthworm.
Earthworm, I love it. Oh my God, you changed my life today. I didn't know this. So they crawl up from underneath in where the plants are, and it's so apropos that Miss Hendrickson told us about soil today. They come up from the soil where your feet are planted, and they go up and they poke their little heads out to the sun up there on top where they meet up with the extensor digitorum longus. Thank you. My life is now complete. I'm retiring after you guys graduate. That's it. I'm serious. Miss Hendrickson.
Yeah, I just had a comment because I saw this, I don't know if it was like a documentary or something, where there was this girl who was born without arms. And she learned to do, like, everything with her feet. Like, she even learned how to put contacts in with her feet and write and everything else. So, we're very adaptable creatures. So
right, and your hands and feet are very similar. It's just that, like what Ms. Ablos was kind of pointing out, we stick them inside a shoe, and, you know, if you put your hand inside mittens at a very early age, you guys wouldn't be able to do all the stuff you can do with your hands right now. You'd have to relearn all that, right? We think, oh, I've got these long fingers, and that's why I can do all that stuff. Yes, long fingers help, and long fingers are better than short toes. But yes, I've seen that documentary. She can do it more with her feet than I can with my hands.
Yes,
period.
Amazing.
Period. Not just her feet, by the way, her hips and everything. She was able to, like, I was just like, oh my God, yeah, incredible. Thank you. Mr. Richards.
So because I like to go in between the bones of the fingers and the feet, so am I hitting the lumbricles or am I hitting the plantar interossei?
Okay, so thank you for asking that question. Thank you. So, if you are on the bottom of somebody's foot, which is where most of us rub, right? All right, I want you to rub the top of feet too, but the bottoms are more important. But so let's talk about this, sir, because when we do hands, we call it the hand sandwich. And we talk about these layers, right? But so if you're going from the bottom of the foot, the bread that you come to on that sandwich is the lumbricles first. If you go deeper on the bottom of the foot, then you get to the plantar interossei. If you go deeper still, which no client in the world will allow you to go this deep from the bottom of their foot, you'll hit the dorsal interossei. But what you would do instead is you'd go from the top of their foot and just rub between the bones and hit the dorsal interossei. All you're hitting from the bottom, you're definitely hitting the lumbricles. If you really work between the bones, you're probably getting to the plantar interossei. So it goes lumbricles, plantar interossei, dorsal interossei, and the dorsal interossei are easier to get from the top. You felt them from the top. They're really thin. But I love what Mr. Richards said. What did he say? He said, I'm working the feet between the bones. He's not rubbing over the top of them. He's not doing a pedicure. He's wiggling in there and getting the metatarsals apart. You get a
That's why I'm in trouble with Mr. Singletary. Because I'm getting between the bones.
Yeah, he told me, by the way, he's a little shy and he didn't want to admit this. He told me he loves that and he wishes you would go deeper when you do that. He said he didn't know how to tell you, but he loves it. So he was asking me to do that today.
You know Singletary is listening to this.
Oh, good. All right. Okay, so everybody, we've learned 4 muscles today. And those 4 muscles, 2 are associated with one tendon. The flexor digitorum longus has a 4-sided muscle on the bottom of the foot, the quadratus plantae, that actually inserts into it. Then we've got the lumbricles that have an origin from that thing and go insert into your toes and meet up with the extensor digitorum longus. And then we learned about the interossei muscles. The interossei muscles literally mean the muscles between the bone. And they go to your toes, but they're really between your metatarsals, and they help give integrity, to help pull them together and pull them apart, to give integrity to the flexion and the arch of your foot, which is why Mr. Richards always makes sure to dig through there with like a screwdriver or something, get in there, pen, whatever. Yeah, stop. She's like, no screwdriver. Too much? Too visual for you? Okay.
Well, the top of the foot's super sensitive.
Oh, it is. By the way, yes. Actually, I agree.
You gotta make sure that you're in. If you're gonna go between those bones, if you're not in, you're gonna cause serious discomfort.
You will. I will say, I 100% agree with you. I use 1/10 the pressure from the bottom of the foot that I do on the top. So I don't know what the pressure is, but if I use 100 pounds of pressure on the bottom of the foot, I use 10 pounds on top. If I use 10 pounds on bottom, I use 1 pound on top. It is significantly different. And what I actually try to do with the metatarsals is actually try to wiggle them apart and kind of pry them apart, not just dig in there, because it is very painful. I'm overemphasizing digging because I want you to go deep and I want you to get in there, but you're absolutely right. I really think more about, can I get the metatarsals apart? Right? Can I work between things? And I'm digging between the bones because that helps me get them apart, but I'm really trying to pry the metatarsals or the metacarpals of somebody's hand apart. Right? Cool. I can see some of you nodding. That makes me very happy. So we learned about 4 muscles today. 2 live between the bones. That's the dorsal interossei, which happen to be higher up. They're on the dorsal side. The plantar interossei that happen to be lower down. And then we learned about the lumbricles and the quadratus plantae that both have either an origin or insertion on the flexor digitorum longus. I've released homework for tonight. It is 1 assignment. It is 58 questions, so I don't know why it's so many questions, but it is about the plantae and interossei and lumbricles. And that is all of your homework, and you have a little bit of time to work.